Hi guys, welcome back to my YouTube channel. I'm here with my cousin NEDA.
Hello.
And we're gonna film a really cool video for you guys today, but before we get into the video, I wanted to thank everyone for all the love and support you guys gave me on my last video. Thanks for liking, subscribing, and viewing, and I hope you enjoyed this video. So by the title, you can tell we're gonna be talking about how to get better skin, and I know that's important to everyone. And she's a dermatologist, so I figured this would be the best video to make with her because she's the expert.
I mean, what could I say?
So
my name is NOSRATI. I'm a dermatologist at Village Dermatology in Houston, and I guess you guys have some questions for us. So
yeah, so I picked, there were so many questions, sorry we didn't get to yours. I picked about 20 and we're gonna answer, well, she's gonna answer most of them, and we can start with the first one. Let's get into it. The first question is, what is the benefit of microneedling and why is this such a popular thing to do?
So microneedling, yeah, you probably all have heard about it because I think Kim Kardashian made it famous with the vampire facial, which is actually trademarked, so, you know, we can't really claim that we do that. But what we do and what most dermatologists do is something called microneedling with PRP, which is what Kim Kardashian was talking about when she said a vampire facial. Basically, microneedling, just like it sounds, we take a little pen that has all these little tiny needles on it, we roll that over the skin, and when you create these little holes in your skin, when you're doing it in an organized fashion, when your body fills those holes in, it does it in a more rejuvenated way, and then when you add that PRP, which is actually your own blood, there's these growth factors in the PRP that then help trigger even more collagen and elastic tissue, thereby increasing that, you know, kind of that new rejuvenated skin that you get post-procedure. So it's pretty cool. Usually takes a couple treatments and you can really improve the appearance of wrinkles, acne scars, discoloration, like pretty much all the bad stuff. Microneedling, especially with PRP, makes it go away. It's awesome.
Okay, so the next question is, does diet affect acne?
So I get that question all the time, and honestly the answer is no one really knows. I mean, there are some studies, some small studies that show certain associations with like a high glycemic index diet, which is like, you know, high sugar, which what I always tell patients is, look, sugar's bad for you anyways, so if you avoid it and it helps improve your acne, even if it's a small improvement, it's worth it because, you know, sugar's kind of slowly killing all of us anyway. So
I can't give that up.
I know, but you know, you get one life to live, so you gotta enjoy it. It's not like if you cut out sugar, your acne is gonna disappear. So I don't want to give that impression, but we think that, you know, there is a small association. And then there's also a small association with low-fat dairy. But again, if you stop the dairy, it's not like your acne is necessarily going to go away. It might improve some, and there are some people that think dairy is not necessarily the best thing for us as adults. You know, we sort of actually evolved to not have dairy as we get older. It's a little bit harder for our bodies to process it. So again, you know, maybe avoid low-fat milk. Sugar's bad for you anyways, but it's not going to totally make your acne go away.
So the next question is, how do I keep my skin from breaking out even when I wash it?
Okay, I mean, you should always wash your skin. So, and if you're still breaking out, I mean, there are some over-the-counter products that you can use, but you may, you know, eventually need the help of a board-certified dermatologist. But some things you can do over the counter. So benzoyl peroxide, it's actually been around forever. It's like super cheap. You might have heard of it as like Oxy Wash, but the active ingredient that you're looking for is benzoyl peroxide. We know that that helps, it's what we call comedolatic. It helps kind of prevent the oil from getting stuck in your pores. It helps kill the bacteria. It helps with inflammation. So that's probably your best bet over the counter to help with breakouts. Salicylic acid, which is in a lot of the acne washes, is okay too. It's not awesome. Anything with an alpha hydroxy acid like glycolic is really helpful. We'll talk about that in a little bit. So that's kind of the simple answer.
Okay. Somebody asked me, I have dry and dehydrated skin. Tips on that?
Okay, so people are always like, how, you know, do I need to drink a lot of water? I mean, yes, you need to drink water so you have moisture in your body. However, drinking water doesn't really necessarily translate to having, you know, moisturized skin. So you have to moisturize your skin as well to kind of retain the moisture, because what happens, so our skin, I don't want to get too boring, but it's a barrier. So it's holding the good things in, like water, and then it's keeping the bad things out, like bacteria, infectious stuff. So when you know, the air is dry or whatever, then we actually start to lose that moisture. It evaporates out through our skin because it's not a perfect barrier. So really, when you're using moisturizer, what you have to think about it as is not that it's providing moisture. It's actually kind of just helping to seal those holes in your skin so you hold in the moisture. So what's helpful when you're putting like moisturizer on, it's helpful if your skin's a little bit damp and then you put your moisturizer on. It also matters what moisturizers you're using, so we'll recommend some of those. But you can't just put like a thick moisturizer on dry skin because there's no moisture there. There's got to be some moisture either from within or a little bit on the skin. You hold it in with the moisturizer.
I didn't know that. I just learned something new. Well, that was kind of my next question. Someone was asking, how much water do you think they need to drink for their skin to stop being so dry? I mean, you know, 8 cups a day, do that, but you don't have to drink like 50 gallons of water to have moist skin. Okay. It doesn't translate. I hope this is answering all y'all's questions. Y'all have some good questions. So the next one is how to get rid of acne scars. There's a lot of these.
Okay, so honestly, and what we talked about earlier, so microneedling, and it's good for any skin type because you probably heard of lasers for scars and stuff, and lasers are great, but you have to have usually fairer skin. So when you have a darker skin type like Della and I, you have to be a little bit careful because lasers can actually cause darkening of the skin. It can cause scarring, burning and scarring. And so with microneedling, that's extremely unlikely. Any skin type, even the darkest, you know, skin can tolerate microneedling because you're not using heat like you are with lasers. So microneedling is safe for every skin type. It helps with acne scarring. That's probably your best bet because honestly, one thing that's important to know about scars, there is no procedure right now that 100% gets rid of a scar. So the best way to treat a scar is to prevent a scar, which is why you should treat acne before it scars. But if it's already there, then you need to do something procedural. There is no cream that's going to make your scars go away. Sorry to
hopefully one day, maybe the next generation will come up with it.
I know.
So please recommend me. Yeah, exactly. Please recommend me a face wash that actually works. I've tried so many products, I'm not happy with anything.
Like I said earlier, benzoyl peroxide is great for acne, but the other thing that's really helpful are alpha hydroxy acid, and I know I sound like I'm repeating myself. So glycolic acid's a really great one.
This is what I use
in my clinic. Oh, this is Della's. Yeah. I brought out the LHA cleanser gel. So we carry a lot of SkinCeuticals here. They're an awesome company. They really try to, you know, their products don't have a lot of extra crap like the fragrance and stuff that can be really irritating, so they're pretty much good for anybody's skin. They've been around forever, so tried and true. This one, basically it has an alpha hydroxy acid, and so it really helps to get all that dirt and oil off your skin, and so if nothing else, it makes it look pretty.
What do you use? They were asking that too.
So I actually like, because I use all kinds of stuff to help with that, what I just said, like the oil, and I'm kind of overdoing it because I'm a dermatologist, right? So I just like something super gentle, and so the Elastin, you want to show them? I don't know how this stuff works. I'm going to probably just block. The Elastin Gentle Cleanser I really like. It's just really mild, it has kind of a nice smell without having any fragrance. So that's my cleanser.
And I use this, which is a SkinCeuticals Simply
So that's another, it's kind of like mine. It's pretty just standard fare. It's not going to make your acne go away, but it's going to clean your skin. So, you know, and actually there's so much junk that our skin is, again, remember, it's like your most important barrier to the outside world. Think about all the pollutants that are floating around in the air, and so that, you know, that just kind of gets stuck in your pores. So it's really important to cleanse every day.
And I love this. I'm very happy with it.
Oh yeah, there's a lot of great products. It's sometimes hard to narrow it down to one or two.
Okay, next question. What is both our favorite daily moisturizers?
You go first.
Okay, so this is my favorite daily moisturizer. It's also SkinCeuticals. So zooming in right there. It's very light, and I have really oily skin, so I feel like it balances my skin. I don't get that oily when I use it.
So I'm old, y'all, so I have to use the stuff that is pretty oily. So actually, it's in the name. It's called Triple Lipid Restore, and this is one of SkinCeuticals' best products. So most people, again, old people, we've heard of it because so it's literally in the name. So lipid is a, you know, basically a fat, and we have, like I was saying earlier, remember the skin is a barrier. I know you've heard that a million times now, but the way that we kind of hold in some of that moisture is that we have all these fats in our skin, and so there's all kinds of different fats. There's cholesterols, there's so anyway, so the triple lipid is kind of restoring, and especially as we get older, those fats that our body makes to put in our skin to hold in moisture, they start to decrease and deplenish. And so you know, this moisturizer helps to restore that, and so that you get to keep that moisture.
Should I be using that instead of that?
Well, you're still young, so you don't really have to worry about that. This is for us old ladies.
Okay, I'll come back to that in a couple of years. Can acne come back after doing Accutane?
Sadly, yes. I love Accutane. I've done it myself. You know, we prescribe it a lot here because honestly, it is a miracle drug for acne. So nothing works as well as Accutane. Now, it's a big undertaking. You know, you have to see a board certified dermatologist. You have to get seen pretty regularly while you're on the course. But it is, you know, the most dramatic results you'll ever see with acne is with Accutane. And overall, as long as you don't get pregnant, that's the biggest issue with Accutane. It is a safe drug. It's a derivative of vitamin A. And we usually say it depends on kind of the person, the type of acne, but usually about 50 to 60% of patients don't ever have acne again. So that's pretty great numbers, but you know, the rest can. Now, usually it's not quite as severe when it comes back and more manageable, but it can come back and it can come back just as bad. So there's no guarantees, but it's still the best thing we've got as of 2020 to treat acne. So once you've seen it, I know people have heard so much bad stuff in the, you know, it has such a bad reputation, and it's not fair because it really doesn't deserve that reputation. You'll probably get all these comments about, oh my god, Accutane ruined my life, but usually that's not the case. It's usually not because of Accutane. There's other things that, you know, Accutane's been blamed in the past for causing depression and inflammatory bowel disease, but actually there have been these meta-analyses, these large systematic reviews which have shown really no association. So I'm not saying that somebody who's taking Accutane can never get depression, but there's other reasons that people get depression. So, you know, yes, there are side effects, but actually the actual side effects are not usually dangerous. You have to be monitored by a board-certified dermatologist. I can't stress that enough. But if it's done correctly, it is a safe drug, and it can literally change someone's life.
So don't let Accutane...
don't be scared.
Yeah,
go talk to a dermatologist. If it's for you, great. If it's not for you, great. There's other options too. But don't necessarily let what you read on the internet scare you away from something that could completely...
If you go to her practice's Instagram, it's at Derm Houston. I'll put in the link below. You can see a lot of like before and after pictures of like your patients. Or
I think we're not, because we're old, we're not so good at
No, I've seen a couple, and it's actually crazy how different it is. So I'll put the link in.
We should put more before and afters, but yeah, no, it's great. It's the best.
Okay, next one. Best kind of facial you recommend?
Like okay, so
like
that's
a beauty
easy.
facial.
Hydra Facial.
I love Hydra Facial.
So Hydra Facial is awesome. Basically, it's just going in and cleaning your pores out. And you know, I know a lot of people go to like an esthetician and get a facial, and honestly, a lot of times that's irritating to your skin because they're using like pressure and they're just pushing on your pores. And although sometimes that, you know, you can clean them slightly that way, however, a lot of times you end up pushing all that junk further down, and then you can actually cause irritation. You could cause breakouts. So Hydra Facial is completely different. You are usually literally injecting water into your pores, and then you're sucking it out. So, and it's pretty cool at the end. You get to see all the junk that was in your pores.
It's so satisfying. I'm always on my every few months Hydra Facial on my schedule.
So if you're into facials because you think they feel good and you just want somebody to rub on your face, great. Go to the esthetician. Just be careful because you might get a little more acne afterwards. But if you want something that's going to actually give you some results, Hydra Facial are awesome. You look really good afterwards, so it's really great. Like if you're going to like a gala, or you guys are too young. I don't know. What do you guys go to? A wedding.
If
a
anyone's
concert.
in high school, prom's coming
prom.
up.
There you go. That's what I was. So it's great for like the day before or the day of. It's not like a chemical peel. Sometimes you gotta wait a week or so before you see the results, but Hydra Facial, you look glowy right after.
Yeah, you're glowing.
Exactly.
It's beautiful.
But it doesn't necessarily feel good. It's not like a face massage.
It doesn't hurt though.
It doesn't hurt, but don't think you're going to get, you know, somebody like, oh,
it's not like a spa treatment.
And yeah, exactly. But it's a real treatment. You can get real results. So.
Next question. What is the right age to start doing Botox?
So there is no right age. So, okay, so Botox, I get this all the time too. Oh, but I'm too young. Maybe I'm starting to see some lines, but I feel like I'm not old enough to get Botox. It's not like you hit 40 and then, you know, now it's time. Botox is preventative, right? So literally all that's happening, but you know, there's a lot of different toxins on the market. We all say Botox, but there's lots of different ones, and I feel bad because they don't The other ones don't get ever mentioned, but basically these are all neurotoxins that come from the botulinum bacteria, and when you inject them into your muscles, you paralyze the muscles temporarily. It's extremely safe, been around a long time, and so when you're not moving your muscles, then you're not getting you're not creating these little what we call dynamic wrinkles, so from movement, and so you can start at, in your early 20s so that you never get a wrinkle.
I do it, and she lets me do it, and she's very like, I want to get rid of my freckles, and she doesn't let me. So
no,
she's
because
strict
there's
on
no
what
reason
I
to have a wrinkle. Why would you ever? Come on, again, it's 2020. Why would we have wrinkles if we don't want them? If you like them, great. If you don't like them, don't have them. There's a way to get rid of them, and it's totally safe. And when you start early, you don't have to do. I think people think, oh, I'm gonna look like one of these weirdos. My forehead's not gonna move. Obviously, I'm moving, and I'm moving too much. I need some. But the point is, you can do a little bit when you're really young. You can start out with small amounts, so you look very normal. You're just helping to prevent those wrinkles from ever forming. Sure, when you're 60 and you're starting, you might need a lot more, but it's already kind of, it's not ever too late. But it's way better. Prevention is always the best way to deal with it. Do it.
Next question. What is the how beneficial, sorry guys, how beneficial is sunscreen? I know you're very,
God.
I knew this one's gonna get her started.
It's only the most beneficial. So I was just talking about dynamic wrinkles. So there's also kind of what we call static wrinkles. So unfortunately, Botox can't prevent all aging. Most aging, not just wrinkles, but loss of, texture changes as you get older, the sagging skin, the downward progression of our faces, everything starts to move downward as we get older. All that is really attributed to sun exposure. So the sun it's UV radiation, y'all. It's toxic, it's bad. So, basically sun protection is the most important thing you can do for your skin. Not just for aging, which I know you guys all care about because you're young, you want to look good, but I mostly do medical dermatology, and so all day long I see skin cancer, and most of it luckily is not the melanoma kind. It's what we call basal cell and squamous cell, and those are not usually lethal, but they're the kinds where people have like half their ear chopped off, or part of their nose comes off, or they have a huge scar on their face, because it's usually stuff that's exposed, like your face. Always get sun every single day. You should be wearing sunscreen every single day, because whether you think you're out there or not, you drive to work, you drive to school, whatever, you're getting sun. So it's so important to do a little moisturizer with SPF every single day. It's going to go a long way. It's going to help you look young and beautiful forever, and it'll help prevent skin cancer. There's so many, discoloration, like she was saying, freckles, people who have rosacea, the sun makes it worse. So it is the #1 thing you can do. Yeah.
So next question, what sunscreen do you recommend, drugstore and pricey?
Okay, so I think the most important thing is that you do sunscreen. So it doesn't really matter, but it does, but just do the sunscreen. Now, if you're doing it, let's talk about which ones to use. So you probably saw that article on CNN about how sunscreen's bad, which is, I'm just generalizing, it's not. But the point was that when they did this study on people who were putting chemical sunscreens on, people were absorbing a lot more than they had previously kind of assumed. And so my answer to that, whenever patients ask me about that, is that don't use chemical sunscreens, just use mineral-based sunscreen. So those are the zinc or titanium-based sunscreens. So that's what I like, because also the chemical sunscreens, we do know, I'm not saying they're harmful, I do not think they're harmful, but we do know that they harm coral reefs. Don't think they harm humans, but maybe they do harm coral reefs. So just fine, avoid chemical sunscreens. There's a million wonderful mineral sunscreens on the market now. So again, zinc or titanium. I personally like EltaMD, makes some great sunscreen. Most dermatologists you ask are going to talk about Elta. It is like your basic B. It does the job. It's not overly priced. I mean, it's not overpriced or anything. This one, UV Elements, is a physical sunscreen, so it only contains a mineral-based sunscreen, and so it doesn't kill the coral reefs, and it's totally safe for humans. And this one's got some tint to it. Actually, yeah, this one's got tint, which I love, because I don't really wear makeup very much. Don't look at me now, this is way more than I usually do. So literally all I do is a little concealer, because I'm old, and a tinted sunscreen. So it's great.
It looks great on your skin.
Thank you.
And also, I don't know if you guys ever watch like those celebrities on Vogue doing their makeup. I feel like every single one uses this. So it's really popular. I use that too, but I also use the SkinCeuticals Light Moisturizer because it's at 50 SPF, and I have a lot of freckles, and dark spots, so I try to use a high SPF.
Yeah, SkinCeuticals makes a great one called their like, you know, Physical Fusion as well. So again, I'm all about anything that says physical or sensitive skin or mineral sunscreen. Those are your best bet. So there's so many great ones. It's just so hard to pick.
So let's say you have makeup on and you can't obviously put you know, sunscreen on top of your makeup.
So she's fishing for this product because I talk about it like nonstop. So this is Color Science's powder-based sunscreen. So here, I'm gonna show them. It's SPF 50, again, all mineral-based, and it's a powder. Now, actually, I think my #1 fan are golfers because this stuff, it's not a cream, right? Like old men don't want to put like moisturizer on their skin. You just can't make them do it. But this is just, it's a powder. It goes on, you can't see it. Doesn't look like anybody has makeup on. And it doesn't run. So if you're really active, it's waterproof.
Next question is, what is both of your favorite products to use for nighttime and morning routine?
Go, you first.
Okay, so I don't really know what I'm showing you guys. This is just stuff that her and people in her office have told me to use, but I always first start with this eye gel that I just put under my eyes. I love this stuff, and that's morning. So first I'll put this on after I cleanse my face with this that we already talked about, and then I'll put, I don't even know what this is, it just feels so great when it's on your skin. But I use
CE Ferulic, everyone needs that. It's an antioxidant. I'll talk about that.
Okay, it sounds weird, but this stuff is amazing. I use 2 drops of this, and then at nighttime, after I cleanse my face, again with this, and then I will put my sunscreen on after I put those 2 on. And then again, cleanse my face at night, and then I'll use this glycolic. Oh, it's okay, me too.
Glycolic 10 overnight renew, that stuff's the bomb.
Are you supposed to use this every night?
You can if you can tolerate it. So it literally, like, you know, resurfaces your skin, makes you look shiny and pretty.
Yeah, okay, so I love this stuff.
So I kept talking about alpha hydroxy acids, glycolic. That's like the #1 alpha hydroxy. So it's great.
Really good. It's made such a difference to my skin. So I use this at night. After I use that, I'll put some of my daily moisturizer on. So I put my daily moisturizer on at night instead of in the morning. So that's my little routine.
Cool. Okay, I know I've talked a lot, so I'm not going to bore you. So I'm just going to break it down, okay? There's 3 things you need. #1, you need sunscreen. I already talked about that. #2, you need a retinol, and I'll talk about that in a second. And #3, you need an antioxidant. That was that CE Ferulic you were mentioning. So I think it's really important when somebody's trying to come up with a routine to keep it simple. Okay, so you always need to wash first. So like she said, I use my Elastin, and then after, you're usually going to put some sort of like medicated active serum type product. So I mean, I do a lot of different things, but so Fluoretin CF or CE Ferulic, these are the 2 antioxidants, the 2 most popular SkinCeuticals antioxidants. So CE Ferulic is for older skin, actually. Usually it's more moisturizing, and then Fluoretin CF is more like for acne prone skin, so it's not quite as oily. So the main ingredient in both of these is vitamin C. But this one has CE, has vitamin C and vitamin E, but vitamin E is a more of an oily product, and so that's why it's more moisturizing. Fluoretin is for people who tend to break out more, and so it's not as oily. But both antioxidants, both are a super important part of your regimen. So that one goes on, actually you can do it both morning and night, but definitely morning, because it helps kind of prevent free radicals that you're getting from UV exposure and pollution and all that stuff. And then I always have to do so basically wash your antioxidant in the morning, and then I do, I can't leave the house without concealer because I'm old. And I really like, so Color Science, the powder people, they make it's called their Total Eye, and so it's a concealer that has sunscreen in it. Because again, the sun is aging, causing all these tiny little wrinkles that you get under your eye. And well, but it's also a concealer, so it's like a one-stop shop. So you put your concealer and you get some sunscreen in there. So I love that stuff. And then I usually do some sort of eye type stuff before. Oops, I didn't tell you about AGE. So she does the Fluoretin one, AGE, just another really great eye product. This one has like blueberry extract and stuff, and it just helps with like that puffiness and dark circles. And then, okay, then let's talk about bedtime. I wash, and then the most important, other than sunscreen, is a retinoid. Now, I just brought you the retinol to see. Do you want to show the folks at home? But I actually use a super strong prescription retinoid. So retinoids are the #1 thing for anti-aging, wrinkles, dark spots, pores, all that stuff. When you are first starting out, they will tear your skin up, like you'll peel, you'll look red. it's awful. So it's better to start with a milder product like the SkinCeuticals retinols, or really any retinol, and then work up to the prescription product. I've been doing this for years and years, so I use the strongest. It's called tazarotene, but you got to get there. You can't just do it overnight. And then I like, so you can either do something like the glycolic 10, so wash your retinoid, and then you can do glycolic 10, but again, you might look even worse if you're just starting out on a retinoid. I like the retexturizing activator, so it's also a, like it says, retexturizing, so it has actually has something called urea in it, which is what's in urine. Oh, but
interesting.
I know, but what it is, it's an exfoliant. So it helps to literally take off all that extra dead skin. So it really helps with like brightness and glow. I remember when I first started using that, people were like, why is your skin so glowy? I was like, oh, it's the retexturizing. And glycolic 10 does a very similar thing. So wash, retinoid, some sort of maybe exfoliant, so either glycolic 10 or retexturizing, but be careful with this stuff. If you do all this at once, you're gonna look crazy. And then you gotta moisturize so that you don't look crazy. And that's where my triple lipid comes into play. So, but it's not crazy, it's not too many things, right?
No, and you'll be happy with the results.
Mm-hmm.
So I think we talked about is washing your face really matter? You said that.
Yeah, do it.
And the next question is, how many times a day should you cleanse?
So, you know, at least once for sure, but preferably twice. So morning and night.
Do you do it twice?
I do.
So do I. Explain a chemical peel.
Well, a chemical peel, there's so many different types. So, but basically, essentially what you're doing is, again, you're removing layers of skin. So you can do a superficial chemical peel where you're just taking the top layer of skin off, and you might not even peel with that because it's so superficial, you just kind of, the dead skin cells are sloughing off, you won't even notice. You can go a little deeper. The deeper you go, the more results you get, but the more downtime you have, right? So if you do like a, let's say if you're going into the second layer of skin called the dermis, that actually gets a little bit more risky. You can even get some scarring, so you have to be really sure you're doing it with a, this is where, again, we see people coming in with scarring and stuff because they've gone to some random person who doesn't know what they're doing. People can hurt you with chemical peels. They're not totally safe. And so basically though, when you go into that second layer of skin, you can improve the appearance of wrinkles and scars because you're really affecting where those are, where they are in the skin. And chemical peels are sometimes, I don't know if you guys probably watch YouTube videos of people's skin coming off in sheets. That's usually after a chemical peel. You're exfoliating. It just depends on what level or where in the skin you're exfoliating to. And the deeper you go, the better results, more risk.
But can any age do it?
Any age can do it. Skin type, again, skin color really matters. So darker skin types have to be extremely careful because when they heal, so if you're going into that second layer of skin, you're potentially creating scar tissue, and a lot of times when that heals, it heals with like really dark discoloration, and so you just have to be really careful.
Okay, and our last question is one product for your skin you cannot live without.
You're asking a dermatologist.
I know.
Well, it's got to be sunscreen. I mean, that's always the right answer. But also a retinoid, because I'm actually 850 years old, but...
No, she's not.
But the retinoid is so important. I mean, sunscreen is so important. Retinoid and antioxidant. Okay, 3.
I'm just going to give you one. I think I'm going to go with my daily moisturizer, because I just love the way I feel after I put the stuff on my face.
Awesome.
Well, I want to thank you so much for sitting and giving all this information, and I'm so glad that you guys enjoyed it. I hope you enjoyed it.
I feel like I just talked a lot. I'm sorry if I bored y'all.
No, I think it was awesome. So many people ask about like my skin routine and stuff that I use, and I feel like it's so important these days for like, especially my generation, for having good skin. Everyone keeps up with it. So I thought this would be the best video. Yeah. So like, subscribe, and I'll be back.
Like her, she's awesome.
Oh, thank you. I love her so much. I'll be back shortly with another video. Okay, I want to show you guys her office a little bit. If you're in the Houston area, you have to come check it out. Everything we talked about is here. You can do any of the treatments. We have this whole section of SkinCeuticals, and we also explain this, NEDA. No, explain this to us, this makeup.
This is Jane Iredale. Again, it's mainly made for people with skin issues, so it's very, gentle. It's not going to irritate your skin. I mean, anybody can use it, but even if you have the worst possible skin, all skin conditions, it's safe.